So moving on to Dr. Algerian. Dr. Algerian is a clinical professor of pathology at the University of Alberta and an adjunct professor of the John Doster Health Ethics Center. He's a certified pathologist by the College of Physicians and Surgeons of Alberta and Ontario. As well, he's a fellow of the Royal College of Physicians of Canada and the College of American Pathologists. Dr. Algerian is currently a pathologist at the Division of Anatomical Pathology at the University of Alberta Hospital. He specializes in autopsy, and it has paved the way to his Master's of Ethics at the Joint Center of Bioethics at the University of Toronto. Dr. Algerian speaks for the dead as one of the underprivileged human categories, and they speak for the living. I pass it over to you, Dr. Algerian. Thank you again for being here.
Thank you, Michael, and thank you for this opportunity to present at the John Dossiter Health Ethics Center presentations. Today's title is Conquering the Autopsy Consent Option, abbreviated as TACO, while dodging fake news. While I was researching this or looking for a catchy title for autopsy consent or approaching the family to gain consent for autopsy, I found literature that was very interesting regarding autopsy consent and also a catchy title, an abbreviation TACO. I didn't realize that this could be registered or a registered trademark. And as a registered trademark or Taco Tuesday was registered by several businesses, I think, in the US. So if you're not familiar with the basketball player LeBron James, tried to register the term Taco Tuesday. However, uh, uh, the courts had ruled against registering it. The fact that it was a common phrase used by many, even the existent registered phrase Taco Tuesday in other states had to let go of that trademark. And so it brings us to today, the autopsy consent option, and without any legal issues or a fear of being sued for using Taco Tuesday, we're able to use it today. Maybe it will also help junior physicians remember the autopsy as one of the options after death for our patients and for quality assurance. At the end of this presentation, attendees will recognize key principles of informed consent, the substitute decision maker during the postmortem period, which is labeled legal next of kin, the autopsy consent option during end-of-life discussion, and last but not least, the essential role the primary healthcare provider plays in relaying accurate information versus common misinformation or fake news. First, we'll talk about the key principles of informed consent. They are divided into three elements. So the threshold element or preconditions, information elements, and consent elements. The threshold elements or preconditions are the competence to understand and decide. So the family in this case, or the representative of the family, or the more specifically the legal next of kin or highest ranking legal next of kin, uh, needs to have competence and should voluntarily take the decision without coercion. The second is the information elements. So the information we should be able to disclose the information or the material of the information, and in that it should be the question that should be answered: what does the average patient need to know to be an informed participant in the decision? So that is the information we need to disclose. Next would be a recommendation. So the primary healthcare provider should be able to recommend a plan and alternate plans if needed. And uh, we should be able to make sure that the legal next of kin understands the information and the recommendation and the alternate plans. And third is the consent elements. The consent elements are the decision in favor of a plan or one of the alternate plans, and the authorization or the acceptance and signature of the acceptance on the consent of the chosen plan. And this is continuous. So that means this authorization or consent uh, should continue to be valid until the procedure is performed. If at any time the legal next of kin or whom represents the family, if any wish to dissent or to disagree, this authorization may be stopped at any time, and the procedure will not be performed. So those were the key principles of the informed consent regarding autopsy consent. Next, a specific part of or a special part of the autopsy is who is the substitute decision maker, which may be different in the antemortem from the postmortem period. So in the postmortem period, uh, we use the term, and it is a legal term. It is not a term that uh, pathology has used. It is a termed, as it is a term that is a legal term, and it is the label is legal next of kin. So on the autopsy consent consultation request, this is just an enlarged of the title. This is the autopsy consent and consultation request. And on that form, in the second part, is consent for autopsy. As you can see, that the the highest ranking legal next of kin should write the relationship and the name of deceased and acknowledge here that they understood the reasons for performing the procedure, and they understand section 2 of the autopsy consent information sheet, and they will go to this in the next slide. However, since we are on this area of the consent sheet, the legal next of kin may be able to choose either a complete autopsy or partial autopsy. And in the partial autopsy, they may be able to state the organ that they wish to be examined or the organs they do not wish to be examined. And they may be able to consent for either medical education or research or both or none for the autopsy tissue and samples. Now back to the part two. Uh, so in part two, we can see the explanation of legal next of kin. So this is what the substitute decision maker is in the postmortem period. The legal next of kin there has a hierarchy. The highest is the spouse or adult independent partner, or the executor if they are named in the will. Next is adult children of the deceased. The third are parents or guardians of the deceased. Then the adult brothers and sisters, and then any other adult next of kin. And this is a legal definition and not from the Department of Pathology. And so the legal next of kin is the substitute decision maker. This may not represent the substitute decision maker during the antemortem period, as there may be an appointed substitute decision maker that is not one of these legal next of kin, and depending on the hierarchy, they may be outranked by outranked by one of these entities. The autopsy consent option during end-of-life discussion. Again, just using this catchy abbreviation just to help our junior residents and physicians remember that the autopsy consent is an option that we should be able to offer for the family of the deceased. And the reason we offer the postmortem examination or autopsy is to discover the cause of death, also to identify the extent of disease that is already identified antemortem, but we would like to see the extent of disease or the response to therapy, and to issue an autopsy report regarding the diagnoses on the diseased organs. And this is how the dead delight to help the living. This information is used to maintain quality of patient care, to develop, modify efficacy of treatments, and it helps teach our medical students, our non-pathology residents, and future pathologists. It also helps to have more accurate death certificates and therefore more accurate vital statistics, and therefore we will be able to budget research and clinical health care for the diseases that are either more common or more lethal in our community. This paper is titled the Hospital Autopsy, the Importance of in Keeping Autopsy as an Option. In this paper, they had a conversation with the families on autopsy and wanted to see if this increased the chance of autopsy consent. In this study, they enrolled 1,023 decedent data collected, and either the autopsy was discussed or not, or the family consented or not for the autopsy. In 494 cases, no autopsy discussion was given. However, there was 30 autopsy requests or consents. In 529 cases, there was a discussion regarding the autopsy, and in those, 67 autopsy consents were achieved. And this is a statistically significant change in autopsy consents, uh, uh, leading to the authors to conclude that an autopsy discussion with the family of the deceased will increase autopsy consent. The essential role of the primary healthcare provider in relaying accurate information versus common misinformation. The reason that it is essential is because no one else is better suited to discuss the autopsy with the family than the primary healthcare provider. In this case, the primary healthcare provider may be the physician or the registered nurse that has primary care of the patient at the time of death, or the family doctor. These are the three pathways that I am familiar with and have experience with achieving consent from the families. And so that's why we say this is an essential role of the primary healthcare provider, and they will be required to understand or be able to provide accurate information, both for the informed consent, but also the understanding of any common misinformation or what is labeled very commonly today as fake news, and be able to respond to this information from the families. In this publication, changes in rates of autopsy-detected diagnostic errors over time. The authors have shown over a 40-year period, they studied 53 distinct autopsy series. Um, the autopsy rates in these institutions range from 12 to 100% of clinical or hospital autopsies per death. And so they found new clinical relevant diagnoses in 4 to 24.4%. And this type of study shows that even though in many cases the diagnoses and the antemortem period may be obvious, however, new clinical information may be gained from the autopsy in 4.1 to 24.4% of cases. Uh, Having explained the essential role that the primary healthcare provider plays in relaying accurate information, we should also address the misinformation or fake news that may be offered or may be revealed during our schooling or from the families. I have identified locally that our medical school unfortunately provides some misinformation that we need to address because many of these medical students may not come to pathology or to an autopsy rotation, so they will never be able to um, have this information refuted by a pathologist or someone that understands more about autopsy. Unfortunately, at our medical school, these three points were offered to our medical students. Autopsies are not regularly performed in Canada. It's not like a real big thing. In addition to this being misinformation, it also is a negative view. The way that it is the phrase is worded gives a negative vibe towards autopsy. The second phrase is, and it's only performed when required by law, or the patient was in good health one day and then found dead soon afterwards. That is the definite. These are not the only autopsies that are offered. This is referring to, as I said, a forensic autopsies. What we offer is clinical autopsies, which is quite different. If it is not required by law to have an autopsy, the families have to pay out of pocket, and this is not it is not true at all. Healthcare in Canada is publicly funded. An autopsy is not any different from other publicly funded procedures. Uh, Bansky that appeared recently. I wanted to borrow this as a as something that we would like to use at our at and in defense of the autopsy. So I feel in that way many either not only maybe uninformed physicians or healthcare workers, but also maybe of the family may have judged the autopsy before it had a chance to defend itself and had a chance to explain what an autopsy is, what are the benefits of the autopsy. So before we judge this, and we should be able to have the correct information and answers to incorrect information so that we can explain both to a misinformed colleague or to the community. In this case, we'll use our colleagues' phrase, fake or misinformed sentences and respond to this information. So autopsies are not regularly performed in Canada. It's not like a real big thing. However, Statistics Canada information is available on in my slides. The slides will be offered by uh, the Dossiter Center, and you can go look at the Statistics Canada search engine yourself, or you could actually Google it, and it shows you can use their search engine. In this case, I chose 2019 to 2023. We can see that in Canada, 6.4 to 6.6% of deaths have an autopsy. In Alberta, up to 11% have autopsy. The lower range, such as BC, as low as 3.3 as low as 3%. And then again in Manitoba, you can see it reaches about 12.9%. In Ontario, a little bit less than Alberta, but not as bad as not as low as BC, 7.3 to 8.2%. So it is actually a big thing, and we do perform autopsies in Canada. And it's only performed when required by law. So that is referring to the Fatalities Inquiries Act in Alberta. And other provinces, they may have, in Alberta, we have a medical examiner system, and other provinces may have a coroner system. They're quite similar. With regard, the Inquiries Act, they may be labeled as Human Death Act or Coroner's Act or Fatalities Inquiries Act. And these cases are cases where the medical examiner has jurisdiction. They do not need consent for these autopsies. And that is not what we are talking about today. We are talking about the clinical autopsy that is offered. And we'll take an example of Alberta. They are offered in every pathology department, has access either to the within the North Zone or South Zone. In the North Zone, all these requests will be referred to Edmonton, and in the South Zone to Calgary to perform a clinical autopsy for without being paid specifically for this paying specifically for this procedure. Just of note, there are 3 times more autopsies in the South Zone than in the North Zone. The last phrase that I would like to address is if it's not required by law, then they would have to pay out of pocket. This is incorrect. There is no charge for autopsy procedure. The the autopsy procedure or the reports or any analysis that we perform and any multiple studies we performed at autopsy, including microbiology, histopathology, chemistry, genetic is part of the procedure and is part of the public health offered in Alberta. And then the last phrase that I would like to address is I'm not really sure, as I haven't had any patients who wanted an autopsy. In response to that, I'd like to say if you do not have the experience with something, then you should, and you still insist on teaching that what you do not have experience in, I think it would be advisable to ask a colleague, similar to what we would do clinically. Uh, if you are going to teach something, ask for a consultation. Any colleague that may have experience with requesting autopsy, the information is available online. You can even Google it. If you put in Alberta autopsy, it will show up, and the information of the how an autopsy is performed, the consent information, the lab, and how to reach someone from the lab and to a pathologist on call is available, and you will be able to directly talk to a colleague about autopsy. So in this presentation, we went over the key principles of informed consent in general, but also specifically, we talked about informed consent in the postmortem period and how the substitute decision maker in the postmortem period is titled legal next of kin. We talked about the hierarchy of the legal next of kin and how that legal next of kin might not be the same individual that was dealt with ante-mortem as a substitute decision maker. We talked about the autopsy consent option during end-of-life discussions, offering the autopsy as an option of the family to the family, and we talked about the essential role the primary healthcare provider plays in relaying accurate information about the autopsy and about the limitations of the autopsy and about common misinformation and the response to the common misinformation that may be accessed either online or by communicating with the pathology department. So at the end, what we want to do is accept facts. We accept facts available to us through publications and recognize references or consulting our colleagues that know more about a procedure or have gone through the consent process for a certain procedure or have performed that procedure, and to reject fake information and fake news. And as a last reminder, just to uh, remember, Taco Tuesday, and TACO stands for the autopsy consent option. I'd like to thank everyone for the opportunity to speak on behalf of the dead and the autopsy procedure that uh, plays a beneficial role to both the family of the deceased and to the community as far as quality assurance and as a teaching tool uh, for known diseases, for new diseases, and for new therapies. Uh, and for that, I would like to conclude my talk and give the opportunity for any discussion or questions.